And thanks for joining us this afternoon. Joy News is learning that as many as 14 kidney patients on dialysis may have died between just May and September after the Kolebu Teaching Hospital ran out of some consumables, which led to a restriction of dialysis services to only emergency cases. Just last week alone, the teaching hospital attracted widespread criticism when the facility announced an increment in cost of dialysis services from the known 380 Ghana cedis to somewhere 765 Ghana cedis following a public outburst. That decision has been reversed. In our first episode of the latest series that we have on Ghana's dialysis crisis, we tell you the story of a 54-year-old kidney disease patient, Georgina, who's leaving on prayer due to the inability of the family to afford treatment. Maxwell Agoba has the rest of the story.
Master, why am Ghana for?
54-year-old Georgina Pia lies in the reclined seat at a private facility, the Central Dialysis Center. She just finished her session for the week. Once a vibrant fish seller at the Tema Fishing Harbour, now confined by her kidney condition, unable to afford the lifeline she needs, regular dialysis.
I started getting the symptoms of a kidney condition when my daughter was in the first year of university. Even getting food to eat is difficult. I have to beg before I eat. My mother, who used to support me too, is also blind now. I don't have any helper. I used to sell fish at the fishing harbour and used to get support from my friends, but not anymore. You know the harsh economic conditions now, so I have to beg before I get money for my weekly dialysis at this private facility.
I 54-year-old Georgina Owusu was compelled by the closure of the dialysis center at the Kolebu Teaching Hospital to seek treatment from this private facility. She was hopeful that the dialysis center at the Kolebu Teaching Hospital would be reopened so she could go back there. But the news that she received shattered her hopes of ever going back. She says the increase of dialysis treatment from 380 cedis to 765 cedis is just like the authorities pushing her from behind into a 6-foot grave.
Bring my mom to this private facility, 460 cedis.
Her daughter, 26-year-old Stella Owusu, is the only child of her mother. She says the weekly dialysis sessions have taken a toll on their finances. She says, but for friends and family members, her mother would have been dead.
When they closed in May, we were there, I think about a month later, or it didn't even get to a month. Then you are there, and then one person's picture will be sent. So and so has died. Couldn't get money to dialyze continuously because I think Kolebu was the cheapest place, 380 cedis at that time. Other facilities were taking 500, 550 at that time. And so moving from Kolebu, no source of income, and then you are supposed to wait 550 twice a week or 3 times a week. Most patients couldn't get it. So we've actually lost a lot of patients, both young and old. But the one I can count right now is about 12 patients since Kolebu dialysis unit shut down. Because even bringing my mom to this private facility, 460 cedis twice a week, I don't even get it. So it's once a week I get for my mom. I'll call church members, I'll call friends, and then they'll contribute and I'll bring her.
Lack of proper and affordable healthcare systems is one of the reasons young people hit the streets last 2 weeks to protest. One of them, Nasiba Bawa, was seen charging at the police. In a video that has now gone viral, she told me she was protesting because the 24-year-old man had died because he couldn't afford the cost of dialysis.
A 24-year-old boy died this morning. His father is a teacher. His father is a teacher. Gave over 30 years of his life to the service. Could not afford transplant, could not afford dialysis, 400 cedis a week. What do you mean? Do you know how much taxes they check out every day? God will judge the government.
2 weeks after the protest, I'm at Star Bites at West Legon to meet Nasiba. She usually buys her lunch here. She says government must do more to cater for people who cannot afford the cost of dialysis. She says no one should die because they can't afford to live.
I was so upset, like it got to me, and not even just because Hassan died, but what Hassan represented, even for me, you know, that he represented a lost, like a country that had failed me. Yeah. He represented people who were dying or had died. He represents a lot of things for me. Yeah. And so looking at him and looking at the situation that finally what had gotten me to, it was as though like you were living in a memory yet to happen. Mm. I was angry, that's the word. I wasn't upset. I was angry, and anger is a very rare emotion for me. Mm. It's a very important emotion for me. Like, for you to be angry, yeah. It means that the thing you're angry about is very important, because I would say I'm annoyed, I'm upset. To be angry, it's very important for me.
These stories underscore the urgent need for the government to address the healthcare disparities in the country, ensuring that essential treatments like dialysis are affordable and accessible to all regardless of their financial status. The lives of people like Georgina Mensah and countless others depend on it. Maxula Bagba, Joy News.
We stay on the story because pressure is mounting on government to address the concerns as the Renal Patients Association of Ghana, made up of those suffering these kidney conditions, are asking government to quickly fix the challenges of the cost and also provide many more of the facilities with more dialysis kits. We can now get more from Maxwell Agbuba, who's been following their press conference for us today. He's joining us from the grounds. And Maxwell, there are concerns that more persons may die if nothing is being done. What more is the concern of these patients?
Renal Association of Ghana have been mourning 14 of their members who they say died between the period of May and September. They say that many of them used to get free treatment from the Korle Bu Teaching Hospital. These dialysis treatments was sponsored by some benevolent persons. They say that the Korle Bu Teaching Hospital restricted the dialysis services to only emergency cases. They say they had to resort to the use of private facilities to get that treatment. They tell us that because they're unable to get that treatment, some of them are unable to go for their dialysis treatment.
As we speak, the renal unit has been closed since 22nd May 2023. Up to date, to outpatients. Patients have gone through turbulent times as we struggle to finance our dialysis treatments at private dialysis centers across the city. Unfortunately, during this shutdown period, we have lost about 14 of our friends. Patients with ESRD and this has left the rest of us living in constant fear for our tomorrow. This is because we do not know who amongst our number will be the next to lose their lives needlessly. For the souls of our departed friends, may they rest in peace. Please let's observe a minute's silence for them.
President.
I've been speaking to some of the patients who used to receive their dialysis treatment here at the Korle Bu Teaching Hospital.
This is the water I'm supposed to drink the whole day. Okay. So let's say if I'll take tea, I have to factor it into it. If I'll eat fufu, fufu goes with soup. I have to factor into it. And then anything soupy or anything, we even use the word fluid. You are supposed to factor it into it because the kidney is down and the kidney is not able to extract the excess water. So when you take more water, you can't breathe properly, you cannot sleep, your legs will be swollen, you get your face bruises. So this is the water you're supposed to take. I think the 22nd was a Monday. They reported for dialysis. And when they came, they were told that the consumables are out of shortage, so they should go and find the places to do it. Thank God, in Accra, there are a lot of dialysis centers around, but as to the quality, it's another thing altogether. So we have to go and look for money and go and do it somewhere. So since from that time, the 22nd of May, the place has been shut down to the OPD patients. No OPD patient is being worked there. It's only for emergencies that they are working on them. So it's true, the place has been shut down. As we are talking now, it's still not open to OPD. They are only doing emergencies.
Did these deaths happen because your members, we told majority of them are beneficiaries of some kind of sponsorship arrangement here, so sometimes they come for the dialysis free of charge. These deaths occur because they couldn't raise enough money to go to private facilities or other facilities to get a dialysis? Is that
sure? That was it. That was the bottom line. That was it. Like I said, most of the people who come here are very vulnerable. They don't have the means. They are not working. So where is he going to have that money from? And most of the private sector are charging between 550 and 600 per session. So they don't have. Just this morning, we just had information. One of our colleagues gone.
So that brings the number to a 15?
Yeah, 15. Just this morning, we just had information. One of the guys is gone. I learned he was doing it within 2 weeks because he was not having money to do it. Probably most of them probably are doing 3 times a week. So 3 times a week, you sit down for 2 weeks, you go and do one. That is the end result. So most of them, all these 15 people, I can mention their name, but that is if only the relatives who agreed to me for me to mention their names. I can mention their name offhand to you. Very vulnerable people, they don't have the means to go for the dialysis at the private centers. So it kills them.
I've never passed uni since 11 years now. Yeah, because you eat, you drink. Because the kidney is spoiled, is to the end stage. Yeah, so I don't pass urine. It doesn't come, it's not even a drop. Instead of doing 3 times, I have to do 1. Because if I go maybe Wednesday, I can't go on Saturday. I have to wait maybe Monday. Then I go. I'm suffering, but what can I do? I have no option. I have to manage. Yeah, so that's how we are living.
So we're hearing that 14 of your members have died.
Yes.
Because they didn't.
The most painful one, his name is Charles, but
tell me about Charles.
Charles was a very young, vibrant guy, very handsome. We do send him going to buy food for us. Even when you see, you won't believe he's sick. When there is something, he will be taking care of everything. Even if we are there and we ask the 2 of us, who will go first? Everybody will point to me.
If you say who will go first, what exactly are you talking about?
If we are saying who should die, they will point to me, they won't point him because he's young.
You freely discuss that?
Oh, sometimes we do. When we are there, we discuss what happens to us. Oh, today...
This is what you see death approaching?
We see death every day. We see.
How?
Sometimes, you are there, you may be on the machine, you might not know what will happen. Your heart can fail you, you can die. It comes with heart and diabetes. So if you have diabetes, if you have heart problem too, it causes your kidney to spoil. So
former President John Mahama has also been wading into the conversation, calling for the scrapping of import duties and taxes on consumables and kits used for dialysis treatment. He says it is disincentive for the government to continue to tax the elderly and the vulnerable population.
These promises can be found on page 63 of the NDC Manifesto of 2020. Given the opportunity, we shall bring relief to thousands of our citizens suffering from these ailments. Just this week, there was an uproar when the nation's premier teaching hospital, Kolebu, announced an increase in charges for dialysis treatment by 100%. This was threatening to put the cost of dialysis treatment out of the reach of many patients and their families. The explanation I have read from the Kolebu Teaching Hospital cites the increase in taxes and duties of materials for dialysis treatment as the main reason for their decision to hike the price by 100%. As an immediate measure, I call on the government to exempt medication and kits for dialysis treatment from taxes and duties to maintain this critical lifeline for patients whose survival depends on this treatment. I've had first-hand experience with the story of one of my assemblymen from the Bole Bamboe district constituency where I was a member of parliament for 12 years. This assemblyman had to travel weekly to Kumasi for dialysis treatment because there was no such facility anywhere near our constituency. And there are many places in this country where dialysis is not available. And so if you have kidney disease, you either have to travel to Tamale, to Kumasi, to Accra, Cape Coast, or any of those places for dialysis. And you can imagine the transportation alone, including the cost of the dialysis treatment. Most people cannot afford it. So this assemblyman had to travel weekly to Kumasi from Bole Bamboe, my constituency, for dialysis treatment because there was no such facility anywhere near our constituency. After a while, the cost of transportation to and fro became too expensive to bear. He therefore had to move with his wife, who was his caregiver, to Kumasi near the health facility for ease of treatment. The cost of treatment and care drained the family financially. Despite the monetary support I continued to give to the family, the absence of an opportunity for a transplant led to a deterioration in his condition and eventually to his death. He passed away. These are real life stories. They are not statistics. These are the lives of our citizens, our people. Amidst the current economic crisis and a difficult period for many Ghanaians with worsening hardship, high cost of living, collapsing businesses and unemployment, the government should not be sensitive by passing on catastrophic healthcare costs onto the people with life-threatening diseases, especially the elderly. Because this is akin to condemning them to a death sentence. Many of such patients in this bracket are elderly people.
Also, former President John Romani Mahama there indicating that many of these kidney disease patients are being sentenced to death. That's how he's describing this. I want to bring in a member on the Health Committee of Parliament, Charles Agbefe, who is also MP for Agoti Maziope, joining us right now via Zoom. Thank you, sir, for spending some time with us here on the poll. So let's start off with the concerns of the former president, pointing out that what we should be moving towards doing as a country now is to consider the point where, of course, we will be reversing or perhaps withdrawing all tax components on imports for the dialysis machines. As the Health Committee in Parliament, has this got into your notice, and what do you intend to do?
Thank you very much, Blaise, and a very good afternoon to your cherished viewers. This issue has come to our attention, and I must also extend my condolences to those who passed away because they could not access the reasonably cost or priced dialysis care at Kolebu. When this issue of Kolebu increasing their cost of dialysis, when it came to our attention,
Hello, Charles. We'll definitely, of course, reconnect with Charles Agbefe, who's MP for Agoti Maziope, and also a member of the Health Committee, just at the verge of pointing out to us what Parliament's Health Committee has been doing. Honourable, we lost you briefly on the point you're raising, the point about what you intend to do in Parliament. Yes, we lost you briefly. If you could just take that point for us again.
So, Parliament minority ranking Honourable Minta Akando issued a statement that Kolebu should reverse the prices back to the original. Number two, all those who have paid the new prices should be given or should access the dialysis care to offset whatever increments they incurred as a result of the new prices. But we understand they've closed the places only for emergency cases. What Parliament intends doing and what we've been discussing among ourselves is, one, every fees or charges at Kolebu is approved by Parliament. And this new request of 765 has not come for approval. In fact, before Kolebu charges any fee or any cost to a client, it comes to Parliament for approval through the Subsidiary Legislation Committee. This year, August, when Kolebu met the committee, there was no renal dialysis charges. And so we were all taken aback. And that's why I was happy Kolebu has explained that they did not approve, the management of Kolebu, they did not approve the renal dialysis charges issued by the renal department. This brings to us, or brings to our attention, that there's something wrong there. Because a department cannot just go and increase prices arbitrarily when there is a regime for price charges. And so the first thing is to look at why they are demanding for the price charges. Obviously, the duties and taxes they are paying at the ports, the CD dollar exchange, because we are importing all these items, and then 3, even getting the items quickly and procured is another challenge. And so Kolebu should present to us in Parliament these challenges.
Are you telling me that as a member of the Health Committee, none of these concerns has ever come to your attention?
Blessed, these concerns come to us.
Yeah, so why are you not fixing the challenge? That's the concern of Ghanaians.
It's because government system of waiving taxes on these items at the port is very complex. We are asking for a very remote automated system now. So we list all items that affect the healthcare of our people. It's dialysis consumables and equipment. If you look at the duties and taxes on them, I mean, this is for the vulnerable and the aged in our society. Where do you think they can get these monies from? 765, 560 a week, or sometimes 3 times a week. It is not possible. And so we need to sit with, we've been discussing this. But you know, the situation we have in the country now.
I see.
Government will be busy waiving taxes on other items when what is needed for the healthcare of the people, that is always delayed. And the Minister of Health, they write to the Minister of Health, he sends it to the Ministry of Finance. And you and I know God knows when this will be approved. So they eventually have to go and clear their books, pay those monies, and definitely they'll have to get a markup. They have to get money again to go and import. But I don't think...
You're the minority in Parliament. You've issued a statement as well on this matter. And what you're seeking to suggest is that, first of all, there must be punitive measures. And beyond that, your checks also reveal that, you know, the newly announced price of about some 700 plus cedis is what's been, you know, charged even as we speak at the Kolebu Teaching Hospital. What more facts are you gathering about this? Has the trend has it been reversed? And are you equally demanding for some refund to all the persons that they've illegally charged these fees?
And this is because that was the import of the press conference. First, we demanded that the new prices should not be affected. It should be reversed. Number 2, those who have paid the new prices should be given a refund or be allowed to access the service. And then there is this there's this balance. The balance to be given them can be also used for attending the service. Then we are also asking that Kolebu should put in place a robust structural system where one department cannot just get up without following due process. It should change prices overnight, affecting the vulnerable and the aged. No, we are looking at that. That is where we are not asking for punitive action. We are asking for putting in place administrative structures that will avert this unfortunate situation. Then the next thing we are also asking for government to change its tax waiver system. It's too cumbersome and complex. Right? If you know the number of applications and requests Kolebu and other government institutions have made to the Ministry of Finance to waive taxes on items they've imported, that would help and support vulnerable and the aged in the society. You will be shocked. And they are still lying there. They are still lying there, not approved. And so it's important. And these things come to Parliament. And that's why I think Kolebu should make another case for us. With this case, when it comes to Parliament and they're asking for an increment, we will ask why. And when we know, and we all know, we will then on the floor of Parliament debate and make a presentation to the Minister of Finance. Bring him to the floor of Parliament and tell him that this is not acceptable. In fact, they need to put in a special purpose vehicle just for this. Because losing 14 members, 14 Ghanaians between May and September, just because they cannot afford, it's unacceptable. It's not acceptable.
Okay, there's the issue about the patient as well. Policy measures to be considered, especially when it comes to, for instance, some of these social schemes that we have. NHIS has come up strongly. Why are we not able to, think about, I'm just looking at the possibility where such a scheme can take care of these patients. It's not as though it's too much. Maybe having an NHIS scheme for persons suffering this condition. You have some working experience with that organization. Is it feasible to consider such a policy measure, at least as a cushion for them?
I think NHIS have a very robust actuarial department that can look at the sustainability of adding on renal dialysis cost to the benefit package of the scheme. Recently, NHIS have been adding on even more expensive conditions like cervical cancer and others. Breast cancer and others are also being considered. Family planning has been added on. And so I believe strongly we can make a case for this, for it to be looked at. We can look at, we have the acute and then we have the chronic. Those who have the chronic condition, renal condition, they go almost 3 times a week. The acute is maybe once a week, 1 to 2 weeks. They could look at the OPD cases and see how they can probably subsidize to start with the cost for these patients. And I think it will go a very long way to minimize the death we are seeing. Then number 2, I also think there should be a concerted effort to ensure that we have these dialysis equipment in almost all district hospitals, at least the existing ones, so that patients' cost of traveling, time of traveling will be minimized, will reduce. Those monies they will use to travel up and down, they could just walk into their district hospitals and get it done for them at a reasonable cost without incurring too much travel time, like what His Excellency the President was saying about the gentleman in his constituency. Then finally, I also think there's strong need, a very strong push.
I'm with you, sir. We can hear you. Yes, we're with you, sir.
Okay. I am requesting for a strong push for a new public health alert. President, every health institution now, when they are making a presentation on their top 10 diseases, one of them now is our NCDs. NCDs meaning the non-communicable diseases, which include the renal dysfunction, the kidney diseases, the hypertension patients, and then what do you call it, heart failure and others. It's becoming a rate at which even young people are getting disease. It's alarming. And so there's a need for us to do a lot of public education. How many people do health checks a year in this country? We should encourage people to be checking their health status annually, at least twice a year. If the condition is detected early, the chances of you getting cured or getting to the chronic stage before you start solving is very, very low.
Right.
And so I see some of these challenges, some of these solutions should be a public education, massive public education. We need to pay for it. We need to advertise. We need to educate our people and tell them that the disease is real. This is diseases that we can avoid.
Right.
It is preventable. It is not communicable. It's our lifestyle. And so if we are educated and we are told we exercise once a week or twice a week, and we should be checking our health status, we would avoid renal dialysis.
Parliament is resuming in just about 2 weeks. Will you trigger some processes as the minority in Parliament on this?
We started it already through the public engagement, the press statement we released. And I think when we resume, that will be one of the first few statements I wish I could, with the support of the committee members. This should not be a minority case.
Right.
This is something affecting
a national
in this
crisis,
country,
yes.
both majority, minority. A national issue, yes. And so we should trigger it for a special committee to look at it. What is really happening? I even think the committee should visit Kolebu and find out why the center is too close till now. Why are they only rendering services on emergency cases? Because in this country, Kolebu, the charges are the cheapest. And if you are denying people for OPD services and only looking at emergencies, you are creating a lot of challenge for them. And so we need to go in there quickly, look at it, visit the hospital, know what is happening, try to get an understanding what is happening throughout the country, and then make a proper presentation on the floor of Parliament for us to take a decision on.
All right.
These are things I think we need to trigger now before Parliament resumes.
Grateful for your time. That's Charles Agbeve joining us here on the Pulse, a member of the Health Committee in Parliament.